Devina Patel, and I'm on staff at CCIH. And what I hope to talk about today is just this partnership between CCIH, CHAK, and IRH. And I'll talk a little bit about some of the background work that we've done that has led to this partnership, and then describe this and sort of some of our thoughts moving forward. But briefly, CCIH, all of you hopefully know that we're a membership organization consisting of faith-based groups as well as other affiliates who want to collaborate with faith-based groups. CHAK is a national network of FBOs in Kenya, and the Institute for Reproductive Health. Lauren described some of their activities, but they are an applied research institute within Georgetown University, and they work to expand access to as well as choice in reproductive health. So just a little bit of background. Some of you may be familiar with the survey that CCIH conducted for our member organizations back in 2008. That was just to sort of learn about some of these questions, about the attitudes and perceptions that Christian organizations that work internationally have towards family planning. And I'll just summarize this really quickly, what we found from that survey, just to remind people. But overwhelmingly, we found support for family planning when understood as enabling individuals to achieve their desired number and spacing of children. And more than half surveyed actually already currently provide family planning services, as well as information or other methods. And at the end of the day, our members in Africa just basically felt that there are major unmet needs in family planning. And they wanted to do more, but they lacked resources in a variety of areas. So some of the recommendations that came out of that survey that CCIH has sort of looked at is the need for faith-based educational materials. There's a lot of information out there, but for a faith-based audience, there was that need. And then there's also capacity building in this area, and then some advocacy in issues of contraceptive security, which continues to be a major problem. So what I'll do is I'll talk about what CCIH has done in these three areas in the context of this project. So in the first year, we sort of just wanted to focus on creating a repository of information. And we created this knowledge bank, and if you look on the CCIH.org and the publications list, there's just a wealth of information in the family planning section that provides information for the faith-based audience as well as other groups that have done work in family planning. So just, I encourage you to look through that. The other thing is we wanted to provide technical briefs on family planning written for the faith-based audience. 3 briefs came out of this project. One was a mechanisms of action document that provided just really good information on how each method works, so how do IUDs work and how do just different methods of contraception work. And then Voices from the Global South was another series that we launched, and what we hope to do with that was capture sort of the stories from our member organizations to just short vignettes, one-pagers, some of them case study format, some of them Q&A format. And what we hope to do is sort of highlight the successes and the stories of what our member organizations do in this field. And we hope that these materials actually provide sort of some of this, the needs that the survey came out from. And then looking beyond the educational material, what our goal was in the family planning reproductive health working group was sort of to look at family planning activities and to strengthen those, and specifically looking at faith-based health provider networks, and then faith-based drug supply organizations, and then just our member organizations and affiliates. And so this project that I'm going to describe sort of looks at Christian health associations. And if you were in Rick Sanchez's earlier presentation, he described a little bit of what these are, but they're national networks of faith-based groups, and they're currently in about 26 countries. The color in the pale yellow color, it shows all of the 26 countries, and then the darker brown, they're actually networks but not formalized national networks. So just to show you a picture of the overall reach and breadth of where these networks are contained. To focus in on Kenya, which is where this project worked on, they also have networks in varied scopes and sizes, either hospitals, community-based practices, community-based clinics as well, and just in varied scopes. And then Tanzania as well. you will be able to see sort of the reach in both the MOH clinics and hospitals as well as the FBOs. So what this project summarized, what this project attempted to do was to strengthen the capacity. As we held conversations with these CHAs, they requested this strengthened capacity in this field. And so collaboratively, we worked with the support of the World Bank to work on a small pilot phase project to strengthen the capacity of Christian Health Association in Kenya. What we wanted to do was to improve access to and sort of providing information in a variety of ways. The way we did this, the way we're doing this, is an ongoing project actually. It's a training of trainer model, and basically capacity building is done via trainers who then go in to train other CHWs in the different FBO facilities. And this is done in 7 CHAK facilities in 3 provinces in Kenya. And what is hoped is that we will have sort of a community-based distribution of family planning, and that this is going to be decentralized from the main facilities. Also important to note is that we're working in tandem with mobilizing religious and faith leaders. As Lauren mentioned, the messenger is very important, and so we're hoping to sort of bring the different religious leaders on board. And some of the materials that we have adapted from the first year, we hope to be able to bring those to the project on the ground and be able to use those actually within the project. So going back again to those major 3 needs, just rushing through, contraceptive security advocacy was another sort of request from the survey that came out. And what, the CHAs, our member organizations face a lot of concerns in different areas in contraceptive security. And so back in February, CCIH conducted just a very small information gathering exercise. And what we wanted to do was just to learn in a very systematic way, what are the concerns that Christian health associations face in this area of contraceptive security. I won't go into much depth into what that is, but briefly, just what we learned was that CHAs have, the Christian health associations do have really strong, or they do have storage and distribution systems, and they would like to strengthen those. They're strongly interested in having sort of a greater role in playing, sort of advocating for themselves to strengthen these distribution systems, and they'd like to be able to address these issues themselves as well. So just moving forward, this is in the words of the HF General Secretary, Dr. Sam Wenda, who's based out of Kenya. What we hope to do, just moving forward, is sort of, we hope that family planning will become easily accessible through a community-based distribution system. We would like for it to be ceased, to be restricted to hospitals where it's offered as a medical treatment, and kind of have it be transformed into family-centered healthcare. And ultimately, that voluntary family planning will be accessible for everyone in the family. So I'll take maybe a question or two, but that was just a very quick overview of a couple years of work and just what led up to it and the partnership that was formed between the two organizations.